Before we begin, a quick disclaimer. The information provided in this video is for educational and informational purposes only. It is not intended as professional, financial, or career advice. All career paths, salary figures, and educational requirements discussed are based on publicly available data and may vary depending on your location, experience, and individual circumstances. You should always conduct your own research and consult with qualified professionals before making any career decisions. What if I told you there's a career in the heart of American healthcare that can lead to a six-figure salary, incredible job security, and a powerful leadership role, all without ever touching a needle, drawing blood, or working a grueling 12-hour shift on your feet? What if this career was one of the fastest-growing fields you've probably never heard of? A hidden world that combines technology, business, and medicine into one of the most vital roles in any hospital. You're here because you're looking for something different. Maybe you're fascinated by the medical world, but the clinical side just isn't for you. Maybe you're a tech person who's tired of working on meaningless projects and craves a job with real human impact. Or maybe you're just looking for a stable, high-paying career path that won't be automated away in the next 10 years. You feel stuck between passion and practicality, between meaning and money. Well, this video is your way out. This is your complete A to Z roadmap, your step-by-step guide to becoming a health information manager in the United States. We are going to pull back the curtain on this incredible profession and give you the ultimate playbook for launching your career. We'll cover what these professionals actually do day to day, how much you can realistically expect to earn, from your very first job to a senior director role, and we will break down the exact degrees and certifications you need to get hired. We will even show you the shortcuts and alternative pathways to get there faster, and for less money than you ever thought possible. By the end of this presentation, you won't just know about this career. You will have a concrete action plan to make it your reality. So, what is this secret world of health information management? Let's get one thing straight right now. This is not about being a medical secretary or filing paper charts in a dusty basement. That's a black and white photograph of a world that no longer exists. Today's health information manager is a high-level data professional, a technology leader, and a critical part of the hospital's executive team. Think of a modern hospital as a massive, complex data-generating machine. Every single patient visit, every lab test, every diagnosis, every prescription, every single heartbeat monitored creates a data point. We're talking about petabytes of the most sensitive, most important information on the planet. The doctors and nurses are the heroes on the front lines, using this information to save lives. But who is building and managing the entire system behind them? Who ensures that data is accurate, secure, and available at a moment's notice? Who is the guardian of patient privacy and the architect of the digital infrastructure that makes modern medicine possible? That is the health information manager. You are the air traffic controller of healthcare data. You're not flying the plane, but without you, nothing gets off the ground and chaos ensues. You are the bridge between clinical care, technology, and the business of healthcare. And because of that unique position, the demand for qualified professionals is exploding. The U.S. Bureau of Labor Statistics projects the field of medical and health services managers to grow at a staggering rate, much faster than the average for all occupations. Why? Because as medicine becomes more complex and data-driven, the need for people who can manage that data intelligently has never been greater. This isn't just a job. It's one of the most secure career paths you can choose in the 21st century. And that security comes with a significant financial reward. While salaries vary by state and experience, it's not uncommon for entry-level professionals with the right credentials to start in the $50,000 to $60,000 range. But the growth potential is where it gets really exciting. With a few years of experience and the right certifications, you can quickly move into management roles earning $80,000, $90,000, or $100,000 a year. And for those who climb the ladder to become directors of health information or chief information officers, salaries well into the $150,000 to $200,000 range are absolutely achievable. This isn't a pipe dream. It's the documented reality for thousands of professionals across the country. But beyond the job security and the excellent pay, this career offers something even more valuable: impact without the burnout. You get to be a critical player in patient care every single day. The systems you manage ensure that a surgeon has the correct patient history before a complex operation. The security protocols you implement protect a patient's privacy from cyber criminals. The data analysis you perform can identify trends that lead to better treatments and safer procedures for thousands of people. You are making a profound difference, but you're doing it from a position of strategic oversight, often with a regular 9-to-5 schedule, which is almost unheard of in other parts of the healthcare industry. Let's bust some myths and get specific about what this job actually entails. The world of health information management, or HIM, is incredibly diverse and can be broken down into a few key domains. First, there's data governance and integrity. This is the bedrock of everything. You are responsible for making sure that all patient health information is accurate, complete, and consistent. This isn't just about catching typos. It's about ensuring the right medical codes are applied to a diagnosis, which directly impacts how a patient is treated and how the hospital is reimbursed. A single error can have devastating consequences for both a patient's health and the hospital's finances. You are the quality control expert for healthcare's most critical asset, its information. Second, you have privacy and security. In an age of constant data breaches and cyber attacks, hospitals are a prime target. As an HIM professional, you become the digital guardian. You're the one who understands the intricate laws like HIPAA, the Health Insurance Portability and Accountability Act, not just as a set of rules, but as a framework for protecting people. You design and implement the policies and technologies that keep patient data safe. You are on the front lines of the cybersecurity war, defending against threats that could cripple a hospital and expose the private health details of thousands. Third is the revenue cycle. This is the business side of healthcare. Every time a service is provided, a complex chain of events is triggered involving coding, billing, and insurance reimbursement. HIM professionals are masters of this process. They ensure that the medical services are documented and coded correctly, so that the hospital can get paid accurately and on time. This isn't just about money. It's about the financial health of the entire organization. The revenue you help manage is what pays for new MRI machines, funds cutting-edge research, and keeps the lights on in the emergency room. And finally, there's the most exciting and fastest-growing area: health informatics and data analytics. This is where you transform from a manager into a data detective. You use powerful software tools to analyze vast datasets, looking for patterns and insights. You might help doctors identify patients at high risk for a certain disease, or help hospital administrators find ways to reduce wait times in the emergency department. You're using data not just to document what has happened, but to predict what will happen and actively improve the quality and efficiency of patient care. These 4 domains are the pillars of the profession. And the beauty is, you can choose to specialize in one or build a career that encompasses them all. You can work in a hospital, a small clinic, a massive insurance company, a government agency like the CDC, a healthcare technology startup, or even as a remote consultant. The career is as flexible as it is powerful. Over the course of this presentation, we're going to give you the exact blueprint to enter this field. We'll start by digging even deeper into the day-to-day reality of the job, showing you what a typical week really looks like. Then we will meticulously map out the educational pathways, from a 2-year associate's degree to a 4-year bachelor's, all the way to a master's degree. And I'll show you how to decide which one is the perfect fit for your goals and your budget. We'll demystify the essential industry certifications like the RHIT and the gold standard RHIA, breaking down exactly what's on the exams and how to prepare. From there, we'll move into the job hunt, showing you how to build a resume that gets noticed and a cover letter that lands you the interview. We'll even walk you through the most common interview questions and give you the perfect answers to position yourself as the can't-miss candidate. This is the complete playbook from zero to hired. But before we dive into the degrees and the certifications, we need to answer the most fundamental question: what does a health information manager actually do all day? Forget the generic job descriptions and the vague corporate speak. We're about to pull back the curtain and walk you through a day in the life, from the critical morning data huddle to a high-stakes meeting with hospital executives that could shape the future of patient care. Let's get into it. The coffee hasn't even finished brewing when the first email alert hits your phone. The subject line is in all caps, a digital scream from the hospital's financial system. Urgent. DNFB exceeds 7-day threshold. Your heart rate picks up just a little. For a health information manager, these 4 letters, DNFB, are a constant ticking clock. It stands for discharge, not final billed. In plain English, it means patients have gone home, but we haven't sent the bill to their insurance company. And if you don't send the bill, you don't get paid. Imagine running a massive restaurant where hundreds of customers eat and leave every day, but your cashiers keep forgetting to ring them up. That's a multi-million-dollar DNFB problem, and you're the one who has to fix it. This isn't just about numbers on a spreadsheet. Every chart stuck in this limbo represents a patient's story that hasn't been properly closed, a doctor's work that hasn't been documented, and a crucial piece of revenue the hospital needs to keep the lights on, pay its nurses, and buy new equipment. My job is to be the detective, the diplomat, and the director who gets this entire symphony of chaos playing in tune again. So I leave the coffee and head straight to my desk. The first step is always the same: data. I'm not guessing, I'm diagnosing. I open our electronic health record, or EHR system, the digital brain of the hospital, and pull the raw DNFB report. It's a wall of text and numbers thousands of lines long. To an outsider, it's gibberish. To me, it's a treasure map pointing to the problem. I export the data into a more powerful analysis tool. This is where the information part of my title becomes critical. I'm not just managing records. I'm interrogating data. I start slicing and dicing. Who are the attending physicians on these accounts? What departments are they coming from? What's the common thread? Within minutes, a pattern emerges. A huge spike, nearly 40% of the backlog, is coming from the orthopedic surgery department. That's my first clue. Now I dig deeper. Is it all the orthopedic surgeons? No. I filter the data again. It's not the whole department. It's 2 specific surgeons. And not just any surgeons, they're 2 of the newest, most high-volume joint replacement specialists we just hired. Okay, the plot thickens. It's not a systemic failure. It's localized. This is good news. A targeted problem is easier to solve than a hospital-wide meltdown. But why are their charts getting stuck? The report tells me the holdup is awaiting operative report dictation. This means the surgery is done, the patient has gone home with a new hip or knee, but the surgeon hasn't dictated the detailed story of what happened in the operating room. Without that report, our medical coders can't read it. If they can't read it, they can't translate the complex procedure into the specific billing codes that insurance companies require. If they can't assign codes, we can't create a bill. The entire multi-million-dollar revenue cycle grinds to a halt because of a missing story. My next move isn't to send an angry email. That's what amateurs do. My move is to get up and walk. My first stop is the coding department. I find Maria, my lead surgical coder, already looking stressed. She sees me coming and just points to her screen. "It's the new guys, isn't it?" she says. I nod. They're doing fantastic work in the OR, but their paperwork is a black hole. We've sent them 3 reminders through the EHR system already. This is crucial information. The automated system isn't working. They're either ignoring the alerts or don't know how to use that part of the system properly. This tells me the problem likely isn't defiance. It's a breakdown in process or training. So, my next stop is to find the physician liaison for the surgical department. This is a person whose entire job is to be the bridge between the administrative side, like me, and the clinical side, the doctors. I find David grabbing a coffee. I don't start with the problem. I start with a positive. "Hey David, I was just looking at the numbers for our new ortho guys, Dr. Evans and Dr. Chan. Their surgical volume is incredible. They're blowing projections out of the water." He smiles. That's his win. Now I pivot. The flip side is we're seeing a major backlog on their op report dictations. It's holding up millions in billing. My coders have sent the standard reminders, but we're not getting any traction. I think we need a different approach. David sighs. Yeah, I've been hearing whispers. They came from a hospital that used a completely different EHR system. They say ours is clunky and the dictation module is a nightmare to use on the mobile app. And there it is. The root cause. It's not laziness. It's not defiance. It's a technology and training issue. They're brilliant surgeons, but we've handed them a new set of tools without showing them how to use them effectively. They're frustrated, my coders are frustrated, and the hospital's CFO is about to be very, very frustrated. Now I have a diagnosis and the beginnings of a treatment plan. It's a 3-pronged attack. First, immediate relief. I asked David to personally walk them through the dictation process on their phones this afternoon. Not an email, not a memo, a face-to-face tutorial. Second, a short-term solution. I work with IT to see if we can set up a temporary scribe service for them. Someone who can help them with their documentation for the next 2 weeks to clear the backlog while they get up to speed. It's an added expense, but it's a fraction of the cost of the delayed revenue. Third, a long-term fix. I schedule a meeting with the head of IT and our EHR vendor. We need to figure out why the mobile app is so clunky. Is there an update we missed? A better workflow we can design? This prevents the problem from happening again when we hire the next star surgeon. I spend the next 2 hours on the phone and writing emails, coordinating these 3 steps. I'm talking to IT about scribe access, I'm talking to the credentialing office, I'm drafting a proposal for the short-term scribe budget. I'm no longer just a manager of information. I'm a project manager, a diplomat, a tech consultant, and a financial analyst all rolled into one. I've taken a vague, catastrophic problem, we're not getting paid, and broken it down into actionable, human-sized pieces. By lunchtime, the fire is contained. David has met with the surgeons, who were actually relieved someone was there to help instead of just sending another angry red alert to their inbox. The backlog is starting to move, but my day is far from over. Because that high-stakes meeting with the hospital executives I mentioned, it's at 3 p.m., and the chief financial officer, a woman who sees everything in terms of dollars and days, had already seen that morning's DNFB alert. My job now is to walk into that boardroom not with a problem but with a story. A story of how we identified a multi-million-dollar bottleneck, diagnosed the root cause without alienating our top-performing talent, and have already deployed a multi-layered solution. I need to turn a crisis into a case study of efficiency and proactive management. I'm not just reporting the news, I'm shaping the narrative. And in the world of hospital administration, the person who controls the narrative is the one who leads. The presentation needs to be perfect. It needs to be clear, concise, and demonstrate absolute control. Because in that room, you're not just defending your department, you're proving your value to the entire organization. So you're standing at the front of the room. The air is thick with the smell of coffee and high expectations. The chief financial officer leans forward, looks over his glasses and says, "Our denial rate for cardiac catheterizations is up 12% this quarter. That's a $2 million problem. What's happening?" Silence. Every eye turns to you. The chief of surgery shifts in his seat. The head of nursing looks at her notes. This is the moment. This is where a manager hides and a leader takes command. An unprepared person would stammer, "They promised to look into it." But you've been living with this data for 3 weeks. You saw this storm forming on the horizon when it was just a tiny blip on a spreadsheet. You click to the next slide. It's a clean, simple line graph. You're absolutely right. You begin, your voice calm and steady. We identified the trend starting 38 days ago. The increase is isolated to a single payer, specifically for procedures using a new type of drug-eluting stent introduced last quarter. You let that sink in. You haven't just answered the question, you've reframed the entire problem. It's not a general failure, it's a specific, identifiable issue. You've already done the detective work. My team initiated a deep dive audit. We pulled the operative reports, the physician documentation, and the corresponding billing codes for every single denied claim. What we found wasn't a clinical issue or a coding error. Another click. A flowchart appears on screen. It was a documentation gap. The new stents require an explicit statement of medical necessity for this specific device that wasn't standard practice with the old ones. The payer's automated system is kicking out the claims because a specific keyword is missing from the physician's notes. You can feel the tension in the room release, replaced by a quiet hum of understanding. You've taken a multi-million-dollar crisis and turned it into a solvable process problem. So what's the solution? The CEO asks. Already in motion, you reply. 2 weeks ago, my clinical documentation improvement specialists met with the entire cardiology department. We worked with the IT team to build a new smart prompt into the electronic health record. Now, when a physician documents the use of this new stent, a hard stop appears requiring them to add the specific justification. We've also initiated a retrospective review of all claims from the last 90 days to appeal the erroneous denials with supplemental documentation. We project we can recover over 90% of that $2 million within the next 60 days. This is health information management. It's not about filing charts in a basement. It's about being the central nervous system of the entire healthcare facility. You are the guardian of the organization's most critical asset. It's data. And your job is to turn that data from a chaotic flood of raw information into the clear, actionable intelligence that drives clinical quality, financial stability, and patient safety. Think of yourself as a data detective and a strategic translator. A physician documents a patient's journey in the electronic health record, or EHR. That's the story. Your team of coders then translates that complex medical story into a set of universal alphanumeric codes, like ICD-10 for diagnoses and CPT for procedures. This coded data is the language that insurance companies, government agencies, and researchers understand. It's how the hospital gets paid. It's how the CDC tracks a flu outbreak. It's how medical researchers determine if a new cancer treatment is working. If that translation is wrong, everything downstream breaks. A patient gets a bill for a procedure they never had. The hospital doesn't get paid for the services it provided. Public health data becomes skewed. A simple coding error can be the difference between a $1,000 reimbursement and a $50,000 one. A pattern of errors can be the difference between a hospital keeping its doors open or having to shut down its pediatric wing. This is the immense responsibility of the AHIMA director. You are in charge of the entire life cycle of health information. This is a concept we call data governance. It means ensuring the data is accurate, secure, accessible, and consistent from the moment it's created, at the patient's bedside, to the moment it's archived, potentially decades later. You lead teams that specialize in different parts of this life cycle. Your clinical documentation improvement, or CDI specialists, are on the front lines. They're nurses and other clinicians who work directly with doctors, asking them to clarify their notes. They're not questioning the doctor's medical judgment. They're ensuring the doctor's brilliance is accurately reflected in the record. A doctor might write shortness of breath, but a CDI specialist knows that for billing and data purposes, they need to know why. Is it acute respiratory failure? Is it congestive heart failure? That one clarification can change the entire story the data tells. Then you have your coding team, the master translators. They take that rich, detailed clinical documentation and apply the correct codes. This is a highly skilled, detail-oriented job. Think of it like translating a beautiful, complex novel into a different language, where every single word has a precise financial and clinical weight. This all feeds into what's known as the revenue cycle. This is the financial lifeblood of the hospital. It's the process that starts with a patient scheduling an appointment and ends with the hospital receiving full payment for the services rendered. The AHIMA department is the engine room of the revenue cycle. If your data is flawed, if your coding is inaccurate, if your documentation is weak, the engine sputters and dies. Denied claims, like the one in our boardroom example, are the direct result of a breakdown in this engine. Your job is to keep it running smoothly, efficiently, and with maximum power. But it gets even more exciting. The role has evolved far beyond just managing records and billing. Today's health information manager is a data analyst and a strategist. You're using powerful analytics tools, things like SQL, Tableau, Power BI, to mine the mountains of data your hospital generates every single day. You're looking for patterns, for trends, for insights that no one else can see. You might be the one who discovers a subtle increase in post-operative infections on a specific surgical floor. You'll dig in. Is it a real problem? Or is it a documentation issue? You work with the infection control department. You pull the data on the surgeons, the nurses, the equipment used, the time of day. You slice and dice the information until you find the signal in the noise. And maybe you discover that the infections are all linked to a single piece of sterilization equipment that isn't functioning correctly. By finding that pattern in the data, you haven't just saved the hospital money, you've literally saved lives. You're the one who can tell the chief of surgery which of his doctors is the most efficient at a specific procedure, not just in terms of time, but in terms of patient outcomes and resource utilization. You can prove with data that investing in a new piece of diagnostic equipment will pay for itself in 18 months by reducing patient length of stay. You are the bridge between the clinical world and the administrative world. You speak both languages fluently. You can have a deep conversation with a neurosurgeon about the nuances of their operative notes, and then walk into the boardroom and explain the financial impact of those notes to the CFO in a way that makes perfect sense. This unique bilingual ability is what makes a great AHIMA leader so incredibly valuable. You're not just a department head. You are a strategic advisor to the entire C-suite. You are the keeper of the truth. In a world of opinions and anecdotes, you bring the cold, hard, undeniable facts. So you see the power, you understand the mission. But how do you forge yourself into this kind of professional? How do you build the arsenal of skills required to command that room? It starts long before you ever step foot in a hospital. It begins with a very specific kind of education, a foundation built not just on medicine or business, but on the powerful intersection of both. So, how do you build that foundation? How do you become the person who can speak the language of doctors, administrators, and IT professionals, all in the same meeting? It's not about getting a generic business degree, or a nursing degree, or a computer science degree. It's about pursuing a specialized education designed from the ground up for this unique role. This is where we talk about the two primary gateways into the world of health information management: the 2-year associate's degree and the 4-year bachelor's degree. Think of these not just as different lengths of time, but as two distinct entry points leading to different roles and responsibilities, at least initially. Let's break down the first path: the Associate of Science or Associate of Applied Science in Health Information Technology. This is the fast track. It's the 2-year concentrated dose of the essential frontline skills you need to be effective from day one. This program is for the doers, the technicians, the people who want to get their hands directly on the data. In an associate's program, your curriculum is going to be intensely practical. You'll dive headfirst into the bedrock of the entire industry, medical coding. You will learn to translate every diagnosis, every procedure, every symptom a patient has into a universal alphanumeric language using systems like ICD-10 and CPT. This isn't just data entry, it's medical storytelling through code. You'll learn how to manage patient records, ensuring every piece of information is accurate, secure, and accessible. You'll become proficient in using the electronic health record, or EHR, systems that are the digital heart of every modern hospital. You'll study the laws like HIPAA, not from a theoretical philosophical standpoint, but from a practical, how do we apply this today perspective. The goal of this degree is to make you an indispensable technician. Upon graduation, you become eligible to sit for the exam to earn the credential, RHIT, which stands for Registered Health Information Technician. An RHIT is the master of the what and the how. They ensure the data engine of the hospital is running smoothly every single day. But what if you don't just want to run the engine? What if you want to design it? What if you want to decide where the engine is going? That brings us to the second path: the Bachelor of Science in Health Information Management or Health Information Administration. This 4-year degree is the leadership track. It takes all the foundational technical knowledge from the associate's level and builds a massive strategic framework on top of it. It's where you stop just learning how to do things and start asking why we do them. In a bachelor's program, you'll still learn about coding and EHRs, but you'll also take courses in healthcare finance, learning how those codes directly translate into millions of dollars of revenue for the hospital. You'll study quality management, using data to figure out how to reduce hospital-acquired infections or improve patient outcomes. You'll take deep dives into data analytics and statistics, learning not just to read data, but to interpret it, to find the hidden trends that can predict a disease outbreak or identify a flaw in a clinical trial. You'll study leadership, project management, and strategic planning. This degree is designed to create managers, analysts, and directors. Upon graduation, you become eligible for the premier credential in the field, the RHIA, the Registered Health Information Administrator. An RHI is the master of the why and the what if. They aren't just running the engine. They're looking at the map, charting the course, and building the next generation vehicle. To make this crystal clear, let's imagine a real-world crisis, a cybersecurity breach. A hacker has accessed patient records. The RHIT, the technician, is on the front lines. They're in the digital trenches working with IT to identify exactly which records were compromised, what specific data was exposed, and how to lock down the system to prevent further damage. They are executing the immediate tactical response. Meanwhile, the RHIA, the administrator, is commanding the operation from the strategic level. They are in the boardroom, briefing the hospital CEO on the scale of the breach. They're working with the legal department to manage the mandatory reporting to government agencies. They're developing the communication plan for notifying the affected patients. And most importantly, they're already thinking 3 steps ahead, analyzing the failure points and designing a new, more robust information governance policy and training program to ensure this never, ever happens again. One role is tactical, the other is strategic. Both are absolutely vital. Now, here is arguably the most important piece of advice in this entire video. If you remember nothing else, remember this: your degree program, whether it's an associate's or a bachelor's, must be accredited by one specific organization. That organization is AHIMA, the Commission on Accreditation for Health Informatics and Information Management Education. Let me be blunt. If the program you're looking at is not AHIMA accredited, walk away. It is a dead end. Why? Because AHIMA accreditation is the only way you'll be eligible to sit for the RHIT or RHIA certification exams. Without that certification, your degree has very little value in the professional world. Graduating from a non-accredited program is like graduating from law school and being told you're not allowed to take the bar exam. You have the knowledge, but you can't get the license that proves it. Before you even apply to a school, your very first step should be to go to the AHIMA website and check their directory of accredited programs. This is a non-negotiable career-defining step. Now, a common question I get is, what if I already have a bachelor's degree in something else, like biology or business? Do you have to start all over? Absolutely not. The field welcomes people from diverse backgrounds. For you, the ideal path is often a post-baccalaureate certificate in health information management. These are typically one-year, intensive programs also accredited by AHIMA that give you all the specialized coursework you need to be eligible for the AHIA exam without having to repeat your general education credits. It's a fantastic accelerated pathway for career changers. And for those looking to reach the highest echelons of the field, there are master's degrees in health informatics or health information management, which prepare you for executive-level roles, research, and academia. So whether you're looking at a 2-year, 4-year, or postgraduate program, you're embarking on a journey to learn a new language, a hybrid language of medicine, technology, and business. You'll take classes that sound like they're from different universities. One semester, you're deep in anatomy and physiology, learning the intricacies of the human body. The next, you're in database management, learning SQL and data architecture. You'll study medical law and ethics, grappling with complex patient privacy cases. You'll learn about healthcare reimbursement systems, following the labyrinthine path of money from the insurance company to the hospital. Each course is a vital thread, and by the end, you'll be weaving them together to create a complete picture of the American healthcare system. You choose your path, you find an accredited program, you conquer the coursework and earn that degree. You've built the foundation. But there's one final gatekeeper standing between you and your professional career. A single standardized test that validates everything you've spent years learning. A final boss battle that unlocks the credentials, RHIT or RHIA, that will appear after your name for the rest of your life. And that exam is a beast. It's a beast because it's not designed to test what you can cram into your brain the night before. It's designed to test if you can think like a health information professional. It's a marathon of critical thinking, spanning a vast landscape of knowledge that you've been building block by block. To conquer it, you first need to understand its anatomy, to map out its territory. The creators of this challenge, the final arbiters of your readiness, are the American Health Information Management Association, or AHIMA. They are the keepers of the standard, the organization that says, this is what a competent, trustworthy health information professional looks like. And their exams, the RHIT for associate's degree holders and the RHIA for bachelors, are the gateway. Let's start with the Registered Health Information Technician exam, the RHIT. This is the credential that validates your mastery of the operational, day-to-day foundations of health information. The exam is typically around 150 multiple-choice questions, and you'll have about 3.5 hours to prove your worth. The questions are pulled from several core areas, what AHIMA calls domains. Think of these as the beast's vital organs. You have to know how to target each one. The first and largest domain is data content, structure, and standards. This is the absolute bedrock. It's about 20 to 24% of your exam. This domain asks, do you understand the very DNA of a health record? Can you ensure the data is accurate, complete, and timely? It covers things like assigning medical codes, ICD-10 CPT, which we'll dive into more later, but also abstracting information for databases and registries like a cancer registry. It's about knowing the difference between a patient's chief complaint and their final diagnosis, and ensuring that every piece of data is in its proper place, following national standards. If the health record is a language, this domain tests your fluency. Next up is information protection. Access, disclosure, use, and auditing. This is the shield. Making up about 18 to 22% of the exam, this is all about HIPAA, privacy, and security. It's not just about memorizing the rules, it's about applying them. They'll give you scenarios. A patient's ex-spouse calls asking for records. A police officer shows up with a warrant. A pharmaceutical company wants de-identified data for a study. What do? Who can see what, when, and why? This domain tests your judgment, your ethics, and your ability to be the fierce guardian of a patient's most sensitive information. Then you have informatics, analytics, and data use. This is the brain, the part that turns raw data into powerful knowledge. It's about 15 to 19% of the test. Here, you're not just managing records, you're using them. This domain covers how to pull data for a quality improvement study, how to interpret basic statistics to see if a new treatment protocol is working, and understanding the fundamentals of health information systems and electronic health records. It's about seeing the bigger picture painted by thousands of individual data points. The fourth domain is revenue cycle management, which is the lifeblood of any healthcare facility. At 15 to 19%, this section is critical. It connects the clinical side with the financial side. You'll be tested on your understanding of the entire process, from the moment a patient registers to the moment the final bill is paid. This includes verifying insurance, understanding different payment systems like Medicare and Medicaid, handling claims, and resolving billing errors. If the data isn't coded and managed correctly here, the hospital doesn't get paid. It's that simple. You are the link that ensures the care provided is properly reimbursed. Finally, there's the domain of leadership. Don't let the title intimidate you. At the RHIT level, this isn't about being a CEO. It's about being a professional. Accounting for 12 to 16% of the exam, it covers topics like workflow management, training new employees, effective communication, and understanding organizational structure. It asks, can you work effectively on a team? Can you help manage a project? Do you understand the principles of good workplace conduct and continuous improvement? It's about proving you have the professional maturity to be a valuable part of a modern healthcare team. Now, for those of you on the bachelor's degree path, you're facing a different, more strategic beast. The Registered Health Information Administrator exam, the RHIA. While the RHIT is focused on the how, the RHIA is focused on the why and the what's next. It's broader, deeper, and more focused on management and governance. It's also a longer exam, often around 180 questions over 4 hours. The domains for the RHIA reflect this higher-level strategic thinking. First is information governance. This is the biggest piece of the pie, a massive 26 to 32% of the exam. This goes way beyond data management. It's about creating the entire framework for how an organization handles its information assets. You're not just protecting data. You're developing the policies for data protection. You're not just using an EHR. You're involved in selecting and implementing it. This domain covers strategic planning, data stewardship, and ensuring information integrity across the entire enterprise. It's about being the architect, not just the builder. The second RHIA domain is compliance with uses and disclosures of protected health information. At 18 to 24%, this is the supercharged version of the RIT's information protection domain. You're not just applying the rules of HIPAA, you're managing the entire compliance program. This means conducting risk assessments, developing training for the entire hospital staff, investigating potential breaches, and interacting with government auditors. You are the organization's ultimate authority on privacy and security law. Next is data analytics and informatics, making up 15 to 21% of the exam. Again, this is a major step up. An RHIT might pull a report. An RHIA designs the entire analytics strategy. This domain tests your ability to use data for population health management, for clinical research, for predictive modeling. You need to understand database architecture, data warehousing, and advanced statistical analysis. You're the one who tells the C-suite what the data means and how it can be used to improve patient outcomes and business operations. Then we have revenue management. At 12 to 18%, this domain is less about processing individual claims and more about managing the entire financial health of the organization through its data. This means analyzing reimbursement patterns, negotiating contracts with insurance companies, and developing strategies to prevent fraud and abuse. You're overseeing the entire system to ensure financial viability and compliance with complex federal regulations. Finally, the RHIA exam has a domain on management and leadership, a significant 14 to 20%. This is true leadership. It covers financial management and budgeting for your department, human resources management like hiring and performance reviews, strategic planning, and change management. How do you lead a team through a difficult transition to a new software system? How do you create a budget that justifies a new project? This domain tests your ability to lead people, manage resources, and drive an entire department forward. So, how do you prepare to face a beast like this? You don't just walk into the arena. You train. Methodically. Your first and most essential tool is the official study guide published by AHIMA itself. This is not optional. It's the game's instruction manual, written by the people who designed the game. Get the most recent version of the RHIT or RHIA exam prep book. Read it cover to cover. Second, use the exam content outline as your personal roadmap and checklist. Go through every single bullet point listed under each domain. Rate your confidence on a scale of 1 to 5. This self-assessment is brutal but necessary. It shows you exactly where your weaknesses are. If you're shaky on prospective payment systems, that's where you focus. If you can't explain the difference between a data warehouse and a data mart, you hit the books on that topic. Third, practice questions are your sparring partners. Do hundreds, if not thousands, of them. The AHIMA books have them, and you can find other reputable sources online. But don't just answer them. For every question you get wrong, figure out why you got it wrong. Was it a knowledge gap? Did you misread the question? This process of active recall and analysis is what builds the mental muscle you'll need on exam day. You need to get used to the unique way AHIMA phrases its questions, which often requires you to choose the best answer among several plausible options. Finally, find your community. Join the Health Information Management subreddit. Find Facebook groups or Discord servers for RHIT and RHIA candidates. You are not alone in this. Sharing study tips, asking questions, and even just venting about a tough topic can be incredibly motivating. Hearing from people who just passed the exam is like getting a strategy guide from someone who just defeated the boss. They can tell you what to expect, what areas were heavily tested, and give you the confidence boost you need. Preparing for this exam is a part-time job that you layer on top of your studies or your current work. It takes months of consistent, focused effort. But this isn't just another final exam. This is the key. Passing it doesn't just mean you're done with school. It means you're ready. It's the signal to every employer in the country that you have met the national standard of excellence. It's the credential that opens the door to your first job, your next promotion, and a career of purpose and opportunity. So let's talk about that credential, the key that unlocks everything. In the world of health information management in the United States, one organization stands as the gold standard, the ultimate authority on certification. That organization is AHIMA, the American Health Information Management Association. Think of them as the gatekeepers of professional excellence. Getting a credential from AHIMA isn't just a good idea. For most professional roles, it's a non-negotiable requirement. It's the proof that you don't just have the knowledge, you have the validated, tested, and nationally recognized skills to be trusted with the nation's most sensitive information. When you start your journey, you'll immediately encounter two foundational credentials, the two primary paths into the heart of the profession, the RHIT and the RHIA. Let's break them down. First, you have the RHIT Registered Health Information Technician. This is the bedrock of the profession. The RHIT is the expert on the front lines of data integrity. To be eligible for this exam, you generally need to have completed an associate's degree from a AHIMA-accredited Health Information Technology, or HIT program. The RHIT role is deeply hands-on. You're the one ensuring the quality, accuracy, and security of patient data at the operational level. Think of yourself as a data detective. You're analyzing records for completeness, you're applying the correct medical codes for billing and research, you're compiling data for public health reporting, and you're safeguarding records from breaches. You are the guardian of the individual patient record. The RHIT exam reflects this practical focus. It's a computer-based, multiple-choice test that covers critical domains like data content and information governance, ensuring you know how a record should be structured and managed. It tests you on information protection, covering the privacy and security rules that are the sacred texts of our field, like HIPAA. And crucially, it dives deep into revenue cycle management and clinical classification systems. That's the world of medical coding, using systems like ICD-10 and CPT to translate a doctor's diagnosis into a universal language that insurance companies, researchers, and government agencies can understand. Passing the RHIT exam tells the world you are a master of the technical foundational skills that make a healthcare facility run. It's the perfect entry point for those who want to get into the workforce quickly, who love the detail-oriented work, and who want to build a career from a rock-solid base of practical expertise. Then we have the other path. The RHIA, Registered Health Information Administrator. If the RHIT is the data detective, the RHIA is the chief strategist. This is the leadership track. Eligibility for this credential requires a higher level of education, typically a bachelor's or master's degree from a AHIMA-accredited Health Information Administration or Management program. The RHIA takes a 30,000-foot view of an organization's entire information ecosystem. They aren't just managing individual records. They are designing and managing the systems that hold all the records. They lead entire departments. They develop policies and procedures for data governance. They work with C-suite executives to implement new technologies like electronic health record systems. They manage budgets, hire and train staff, and ensure the entire organization is compliant with state and federal regulations. They are the architects and the commanders of health information. The RHIA exam, as you can imagine, is broader and more strategic in scope. It still covers the fundamentals, but it places a heavy emphasis on leadership and management. The domains on the RHIA exam include things like information governance, where you're not just managing data but creating the entire framework for how it's used across the enterprise. It tests you on informatics and data analytics, focusing on how to leverage big data to improve patient outcomes and business operations. And it has a huge focus on management and leadership, testing your knowledge of strategic planning, financial management, human resources, and project management. Passing the RHIA exam signals that you're not just a technician. You are a leader, ready to shape the future of healthcare information. So you're standing at a fork in the road. RHIT or RHIA? This is one of the first major strategic decisions of your career. And the right answer depends entirely on you. There is no better credential. There is only the credential that is better for you right now. Ask yourself, do you want a faster path into the job market? Do you love the idea of being a hands-on expert, the go-to person for coding, data quality, and record analysis? Does the idea of mastering the intricate details of a patient's story, told through data, excite you? If so, the RHIT path, starting with an associate's degree, might be your perfect fit. Or do you see yourself in a leadership role? Are you passionate about the big picture, about strategy, technology, and managing teams? Do you want to be in the room where decisions are made about multi-million-dollar electronic health record implementations or organization-wide privacy policies? Are you willing to invest the time in a bachelor's or master's degree to get there? If that's your vision, then the RHIA is your target. And here's the beautiful part. This choice isn't a life sentence. The career ladder is built right into the profession. Many professionals start as an RHIT, gain invaluable real-world experience, and then go back to school to complete their bachelor's degree to become an RHIA. Starting as an RHIT can make you an even more effective RHIA down the road, because you'll have a deep, ground-level understanding of the challenges your team faces every single day. But the journey of specialization doesn't stop there. Once you have your foundational credential, AHIMA offers a suite of specialty certifications that allow you to become a true master in a specific niche. This is how you go from being a professional to being an indispensable asset. Are you fascinated by data science and analytics? You can pursue the CHDA, the Certified Health Data Analyst. This credential is for the pros who can take massive datasets and tease out trends that can predict disease outbreaks or improve hospital efficiency. Do you love the clinical side of things, working closely with doctors and nurses to ensure their documentation is pristine? Then the CDIP, or Certified Documentation Integrity Practitioner, is for you. You become the bridge between the clinical staff and the coders, ensuring patient records are not just complete, but perfectly reflect the complexity of care. Are you passionate about cybersecurity and privacy? The CHPS, Certified in Healthcare Privacy and Security, tells the world you are an expert in protecting patient information from the ever-growing threats in the digital world. These specialty certifications are your career boosters. They demonstrate a commitment to lifelong learning and a level of expertise that commands higher salaries in more interesting, high-impact roles. Now, regardless of which path you choose, RHIT, RHIA, or a future specialty, you have to pass the exam. This is your final boss battle. These are not easy tests. They are designed to be rigorous, to uphold the high standards of the profession. But they are absolutely conquerable with the right strategy. First, your number one resource is AHIMA itself. They publish the official exam prep books, which are essentially the Bibles for your studies. They break down every single domain and task you'll be tested on. Don't just read them, absorb them, live in them. AHIMA also offers practice exams, which are critical. Taking these under timed conditions simulates the real thing and exposes your weak spots before they count. Second, don't just memorize facts. The exams are designed to test your critical thinking and application of knowledge. You need to understand the why behind the rules. Why is this coding guideline structured this way? Why is this privacy rule so important? When you understand the core principles, you can answer any situational question they throw at you. Third, find your community. You are not on this journey alone. There are thousands of other students and professionals studying for these same exams. Join online forums on Reddit, like the r/health information and r/medical coding subreddits. Find Facebook study groups. Connect with your local state chapter of AHIMA. Sharing notes, quizzing each other, and simply having a support system to vent to can make all the difference. Preparing for your certification exam is a marathon, not a sprint. It will take discipline, focus, and a lot of late nights. But when you walk out of that testing center and see the word pass on the screen, the feeling is indescribable. It's the culmination of all your hard work. It's the moment you officially transition from student to professional. It's the moment you earn that key. And with that key in hand, you are ready to unlock the door to the job market. You have the degree. You have the credential. Now it's time to translate that power into a paycheck. It's time to build a resume that gets noticed, to craft a cover letter that tells your story, and to walk into an interview and prove that you are the exact candidate they've been searching for. It's time to get hired. Let's start with the brutal truth. A hiring manager will look at your resume for an average of 7 seconds. 7 seconds. That's it. In the time it takes to tie your shoe, your entire professional history, your education, your hard-earned certifications, they're either in the trash pile or the maybe pile. Your resume is not your life story. It's not a comprehensive list of every single thing you've ever done. It is a marketing document. It's the movie trailer for your career. And its only job is to make someone say, "I have to see this movie." Its only job is to get you the interview. So, how do we build a trailer that's so compelling they can't wait for the feature film? We start by understanding who we're selling to. And in today's world, your first audience isn't even human. It's a machine. An applicant tracking system, or ATS. This is the digital gatekeeper, the software that scans your resume for keywords and phrases that match the job description. If you don't have the right keywords, a human being will never even see your application. It's a harsh reality, but we can game the system. Here's the first step. Open the job description you're targeting. Now open a blank document. Create 2 columns. In the left column, copy and paste every single skill, qualification, and requirement from the job description. Every piece of software mentioned like Epic, Cerner, or Meditech. Every regulation like HIPAA or high-tech. Every skill like data analysis, revenue cycle management, or clinical documentation integrity. In the right column, you're going to list your corresponding experience. This T-chart is your blueprint. The keywords in that left column are your golden tickets. You must find a way to naturally weave these exact phrases into your resume. If they ask for INCM coding, your resume better say INCM coding, not just medical coding. The robot is smart, but it's not that smart. You have to speak its language. Now, let's build the resume itself section by section, optimize for both the robot and the human. At the very top, your name and contact information. Make it clean. Your name in a slightly larger font. Below that, your city and state, your phone number, your professional email address, and I mean professional, not skaterboy1998@email.com, and the URL to your LinkedIn profile. Your LinkedIn profile is non-negotiable. It's your digital portfolio, and not having one is a red flag. Next, the most important section, the professional summary. Ditch the old-school objective statement. Nobody cares that you're seeking a challenging position with a forward-thinking company. Of course you are. Instead, you write a 3 to 4 line summary that is a powerhouse elevator pitch of your value. It should immediately answer the hiring manager's question, "Why should I care about you?" A bad summary says, "Motivated professional looking for a health information manager role." A killer summary says, "RHA certified health information manager with over 8 years of experience leading teams in large-scale hospital systems. Proven expertise in optimizing EHR workflows, ensuring HIPAA compliance, and improving data integrity, resulting in a 15% reduction in coding errors and a 20% improvement in revenue cycle efficiency." See the difference? One is a wish, the other is a statement of fact and value. It's packed with keywords and, most importantly, quantifiable results. Numbers are your best friend on a resume. They cut through the noise and prove your worth. After the summary, create a core competencies or skills section. This is your keyword goldmine. Pull directly from that T-chart you made. Organize it into columns with bullet points. It's skimmable and it's a direct feast for the ATS. You can break it down into categories: EHR systems, Epic, Cerner, coding languages, ICD-10, CPT, HCPCS, data and analytics, SQL, Tableau, and compliance, HIPAA, high-tech, Joint Commission. This section is designed to get you past the robot. Now the main event, your professional experience. This is where you tell the story of your accomplishments. Do not, under any circumstances, just list your job duties. That's a job description, not a resume. A hiring manager knows what a AHIMA professional does. They want to know how well you did it. For every single bullet point under each job, you need to use the STAR method: situation, task, action, result. But we're going to frame it as problem, action, quantifiable result. Don't say, responsible for managing medical records. Instead say, spearheaded the transition from paper-based records to a new Epic EHR system for a 300-bed facility, training a team of 25 staff members, and completing the project 2 weeks ahead of schedule and 10% under budget. Don't say, performed regular audits. Instead say, developed and implemented a new quarterly auditing protocol that identified and corrected coding discrepancies, improving coding accuracy from 85% to 98% within 1 year. Use powerful action verbs, not helped or worked on. Use words like architected, overhauled, spearheaded, executed, quantified, streamlined, revitalized. Each bullet point should be a mini-story of you being the hero who solved a problem. Finally, your education and certifications. Your degree, bachelor's or master's in health information management, goes here. But the real star is your certification. Put Registered Health Information Administrator, RHIA, or Registered Health Information Technician, RHIT, front and center. That's the credential they're looking for. Make it bold. Make it impossible to miss. Now the resume has done its job. It's gotten you past the robot and caught the human's eye. But it's a document of facts and figures. The cover letter is where you give it a soul. If the resume is the what, the cover letter is the why. It's your chance to connect the dots and tell a story that the resume can't. First rule of cover letters: never, ever send a generic one. Each one must be tailored to the specific job and company. Address it to a specific person if you can find their name. A quick LinkedIn search for the director of AHIMA at that hospital can work wonders. Your opening paragraph is your hook. Do not start with, I am writing to apply for the Health Information Manager position I saw on Indeed. It's the most boring sentence in the English language. Start with passion and a direct connection. Try something like, for the past 5 years, I have followed hospital name's innovative work in patient data security, and I was thrilled to see the opening for a Health Information Manager, as my experience in data governance and risk mitigation aligns perfectly with the values your organization champions. The body paragraphs are your chance to elaborate on your biggest wins. Pick 2 or 3 key requirements from the job description. Then, tell a brief story from your experience that proves you can meet that requirement. If they need someone to improve clinical documentation, tell the story of how you launched a CDI program at your last job and what the specific quantifiable result was. You're not just repeating your resume, you're providing the director's commentary. You're showing them you've read their needs and you are the solution to their problems. Your final paragraph is the call to action. Reiterate your enthusiasm and your confidence in the value you bring. End with something strong and professional like, I am confident that my leadership in revenue cycle management and my commitment to data integrity would make me a valuable asset to your team. I have attached my resume for your review, and I am eager for the opportunity to discuss my qualifications further. Before you hit send on any of this, you must proofread. Then proofread again. Then have a friend, a mentor, your dog, anyone proofread it one more time. A single typo can be a death sentence. In a field built on accuracy and attention to detail like health information management, a spelling error on your resume says you lack both. It's a silent killer. Your resume and cover letter are your ambassadors. They go into rooms you can't and speak on your behalf. When crafted correctly, they don't just ask for a job. They make a powerful data-driven case that you are the only logical choice. They are the key that unlocks the door. And once that door is open, you have to be ready to walk through it and own the room. You have to be ready for the interview. And the single biggest mistake people make is thinking an interview is a test. It's not. It's a consultation. You are not a student hoping for a passing grade. You are an expert consultant, and the healthcare facility is a potential client. They have a problem or multiple problems, and they are interviewing you to see if you are the person who can solve them. This single shift in mindset changes everything. It changes your posture, your tone, the questions you ask. It moves you from a passive position of begging for a chance to an active position of demonstrating your value. You are there to diagnose their needs and present your skills as the prescription. So let's break down the modern interview process for a health information manager. It's often a multi-stage gauntlet, designed to test you from every angle. It typically starts with a phone screen. This is usually a 15 to 30-minute call with an HR representative or a recruiter. Don't underestimate this step. It's not just a formality, it's the first gatekeeper. Their job is to screen for two things: basic competency and red flags. They're confirming that you have the credentials you listed, that you can communicate professionally, and that your salary expectations are in the same universe as their budget. To ace the phone screen, be prepared. Have your resume in front of you. Have a 30-second elevator pitch that crisply summarizes who you are, what you've accomplished, and why you're interested in this specific role. And when they ask about salary, be ready. Don't be caught off guard. Research the average salary for an AHIMA in your geographic area, with your level of experience. Give them a thoughtful, well-researched range, not a single number. Say something like, based on my research for similar roles in this area and my qualifications, I am targeting a range of X to Y. However, I'm flexible and more focused on finding the right fit where I can truly add value. This shows you've done your homework and are a serious candidate, not just a window shopper. Pass the phone screen and you move to the main event, the interview with the hiring manager, and possibly a panel of future colleagues or department heads. This is where you prove you're the consultant they need. The questions here will fall into three main categories: behavioral, situational, and technical. Let's start with behavioral questions. These are the ones that start with "tell me about a time when," or "give me an example of." Why do they ask these? Because of a simple psychological principle. Past performance is the best predictor of future performance. They don't want to know what you would do. They want to know what you have done. Your weapon to conquer these questions is the STAR method. This isn't just a gimmick. It's a storytelling framework that forces you to be clear, concise, and compelling. STAR stands for situation, task, action, and result. Situation: briefly set the scene. What was the context? Task: what was your specific responsibility or goal in that situation? Action: what specific steps did you take? Use I statements, not we. They are hiring you, not your team. Result: this is the most important part and where most people fail. What was the outcome? Quantify it whenever possible. Use numbers, percentages, and data. Let's walk through an example. The interviewer asks, tell me about a time you had to manage a major project with a tight deadline. A weak answer is, yeah, we had to implement a new HR module once and it was a rush. We all worked really hard and got it done on time. That tells them nothing. A STAR answer sounds like this. Situation: in my previous role at St. Jude's Hospital, we were mandated to implement a new computer-assisted coding module to improve accuracy and efficiency. The vendor gave us a tight 90-day implementation window, which coincided with our busiest quarter. Task: as the project lead, my task was to oversee the entire implementation, from staff training to system integration, ensuring we went live on schedule with minimal disruption to our revenue cycle. Action: first, I created a detailed project plan with clear milestones. I organized a cross-functional team with members from coding, IT, and billing. I personally developed and led a series of targeted training sessions for our 25 coders, focusing on the new workflow to reduce their learning curve. I also established a daily 15-minute check-in to identify and resolve roadblocks immediately, rather than letting them fester. Result: as a result of this structured approach, we successfully launched the new module 2 days ahead of schedule. Within the first 60 days post-launch, we saw a 15% reduction in claim denials related to coding errors and improved our coder productivity by 20%, directly impacting our cash flow in a positive way. The project was recognized by leadership as a model for future IT implementations. See the difference? One is a vague memory. The other is a powerful story of leadership, strategy, and measurable success. Prepare 5 to 7 of these STAR stories before your interview, covering key areas like leadership, conflict resolution, problem solving, and a major failure and what you learned from it. Next are the situational questions. These are hypothetical. What would you do if? They test your judgment and problem-solving skills in real time. For example, what would you do if you discovered a potential HIPAA breach involving a high-profile patient? Don't just jump to an answer. Walk them through your thought process. A great framework is: acknowledge, investigate, collaborate, act, follow up. My first priority would be to contain the situation and understand its scope. I would immediately acknowledge the seriousness of the potential breach. Then, I would discreetly investigate the initial report to verify its credibility without causing a panic. I'd collaborate with our privacy officer and the IT security team to conduct a formal risk assessment. Based on our findings, I would follow our established incident response protocol, which would include taking corrective action to secure the data, determining notification requirements under HIPAA, and documenting every step of the process. Finally, I would lead a post-mortem analysis to understand the root cause and implement new safeguards to prevent a recurrence. This answer shows you are calm under pressure, methodical, and understand the critical importance of compliance and process. Finally, you have the technical questions. These are about your hard skills. They might ask about your experience with specific EHRs like Epic or Cerner, your knowledge of ICD-10-CM and CPT coding guidelines, or your understanding of data analytics in healthcare. The key here is not just to define the term but to connect it to value. Don't just say, "Yes, I'm familiar with HIPAA." Say, "Yes, I've developed and implemented HIPAA training programs for over 200 clinical staff, which led to a 50% reduction in reported minor privacy infractions over 1 year." Always link your knowledge to a result. Now, toward the end of the interview, they will inevitably ask the most important question of all. "So, do you have any questions for us?" Your answer must be an enthusiastic yes. If you say no, you're communicating a lack of interest and a lack of curiosity. This is your turn to interview them. This is where you transform from a candidate into a consultant. Your questions reveal how you think. Don't ask about salary or vacation time. That's for the HR stage. Ask smart, strategic questions that show you're thinking about the role at a high level. Ask about the challenges. What are the 1 or 2 biggest challenges this department is facing that the person in this role will need to tackle in their first 6 months? Ask about success. Thinking about the best person you ever had in this role. What made them so successful? Ask about the team. How does the HIM department collaborate with the clinical and financial departments to achieve the hospital's broader goals? Ask about the future. With the increasing role of AI and data analytics in healthcare, where do you see this department and this role evolving over the next 3 to 5 years? These questions show you're not just looking for a job, you're looking for a challenge. You're evaluating if their problems are the ones you are excited to solve. As you wrap up, give a concise closing statement. Reiterate your strong interest in the role and briefly connect your top 2 or 3 qualifications to the biggest needs you uncovered during the conversation. Say something like, "Thank you so much for your time. This has been a great conversation, and it's solidified my interest in this role. It sounds like your biggest priorities are streamlining the coding workflow and improving data integrity, which aligns perfectly with my experience in project management and my success in reducing denial rates at my last hospital. I'm confident I can bring that same value here." Then confirm the next steps in their process. But you're not done yet. Within 24 hours, send a thank you email. This is non-negotiable. Personalize it for each person you spoke with. Don't just send a generic template. Reference a specific point you discussed with them that you found interesting. This proves you were listening. Briefly reiterate your value one last time. Keep it professional, concise, and error-free. This final touchpoint is one last piece of evidence that you are the detail-oriented, thoughtful, and professional expert they've been looking for. The interview isn't just a conversation, it's the final performance, the closing argument in the case for why you are the solution. So, how do you deliver that final performance? How do you craft a closing argument that leaves no doubt in their minds? It starts long before you ever shake their hand. It begins with transforming yourself from a candidate into a consultant. A consultant doesn't just show up hoping for a job. They show up having already diagnosed the patient, in this case, the healthcare organization itself. Your first step is to become an expert on them. And I don't mean just reading their About Us page. That's amateur hour. I mean, you go deep. You read their last 2 annual reports. You find their press releases from the last 6 months. Are they acquiring a new clinic? Are they implementing a new electronic health record system? Did they just get a new CEO? You need to understand their strategic priorities, their financial health, and their recent challenges. Search for news articles about the hospital. Did they recently face a HIPAA compliance audit? Are they struggling with long wait times in the ER? Every piece of information is a clue, tells you where their pain points are. And where there's pain, there's a need for a solution. A need for you. Once you have this deep intelligence, you start preparing your arsenal. This isn't about memorizing canned answers. It's about crafting powerful stories that prove your value. You're going to use the STAR method: situation, task, action, result, but you're going to supercharge it. For every key competency of a health information manager, data integrity, compliance, revenue cycle management, team leadership, technology implementation, you need a compelling star story locked and loaded. Let's say the job description emphasizes improving the revenue cycle. Your story isn't just, I helped improve billing. No, it's, at my previous hospital situation, we were facing a 15% denial rate on claims related to complex surgical procedures, which was costing us nearly $1 million a quarter. Task: my director tasked me with leading a project to identify the root cause and cut that denial rate in half within 6 months. Action: I assembled a cross-functional team with members from coding, clinical documentation, and patient financial services. We conducted a deep dive audit and discovered the primary issue was inconsistent physician documentation for medical necessity. So I didn't just send a memo. I worked with the lead surgeon to develop a new, streamlined documentation template within the EHR and personally led training sessions with the surgical residents. I showed them directly how this small change in their workflow would protect the hospital's revenue and, more importantly, create a more accurate patient record. Result: within 4 months, we had reduced the denial rate for those specific procedures by 70%, far exceeding our goal, and recovered over $600,000 in what would have been lost revenue in the first quarter alone. See the difference? That's not an answer. That's evidence. It's a case study with you as the hero. You need 5 to 7 of these stories in your back pocket, ready to deploy. Now let's talk about the day of the interview. You walk into that room, and they hit you with the classic opener. So tell me about yourself. This is not an invitation to recite your resume. It is the single most important moment to frame the entire conversation. It's your opening statement. You need a concise, powerful narrative that connects your past, present, and future directly to them. It sounds something like this. I've spent the last 7 years immersed in health information management, starting as a coder and most recently leading a team of 12 as an AHIMA supervisor at a major metropolitan hospital. I've focused my career on the intersection of data integrity and operational efficiency, and I was particularly drawn to this role because I saw on your website that you're launching a new oncology wing next year. My experience leading the EHR data migration for a similar expansion project, which we completed ahead of schedule and under budget, seems to align perfectly with the challenges and opportunities you'll be facing. In 30 seconds, you've shown your experience, demonstrated you've done your research, connected your skills to their specific future needs, and positioned yourself as a problem solver. You've set the stage. You're no longer just a candidate, you're a strategic partner. As the interview progresses, you have to anticipate the tough questions. They will ask about your weaknesses. The worst possible answers are cliches like, I'm a perfectionist, or I work too hard. This shows a lack of self-awareness. A world-class answer acknowledges a real, but manageable weakness and shows you're actively working to improve it. For example, early in my management career, I had a tendency to want to do everything myself, believing it was the fastest way to get it done right. I quickly realized this wasn't scalable and was actually a disservice to my team's development. I've since become a strong advocate for delegation, and I've implemented project management tools like Asana to ensure I can provide high-level oversight and support without micromanaging the process. It's allowed my team to take on more ownership and has freed me up to focus on more strategic initiatives. This answer is brilliant because it's honest, it shows growth, and it pivots the weakness into a strength: stronger team, better strategic focus. They will also ask you behavioral questions. Tell me about a time you had a disagreement with a physician. This is a test of your diplomacy and communication skills. Your story should never be about winning an argument. It should be about finding common ground through data and education. You didn't argue with the doctor. You presented them with data showing how their documentation habits were impacting patient safety or revenue, and you collaborated on a solution that made their job easier while achieving the necessary compliance. You were a partner, not an adversary. Throughout your answers, you must weave in the intelligence you gathered. When they ask about data analytics, you say, that's a great question. I know data-driven decision-making is a core part of your hospital's mission statement, and my experience using Tableau to create dashboards that track coding productivity and DNFB rates would fit right into that culture. Every time you do this, you send a powerful subconscious message. I already get it. I'm already one of you. Finally, we come to the end of the interview. They ask the fateful question. Do you have any questions for us? Your answer must never be, no, I think you've covered everything. That's a catastrophic failure. This is your last chance to shine. Your questions reveal the depth of your thinking. Don't ask about salary or vacation time. That comes later. Ask brilliant strategic questions that prove you're thinking like a manager. Questions like, what is the single biggest data governance challenge this department will face in the next 12 months? Or, how does the AHIMA department collaborate with the Chief Medical Information Officer on new technology rollouts? Or, could you describe what success would look like for the person in this role after their first 90 days and 1 year? These questions show you're thinking about long-term impact, not just the daily grind. They force the interviewers to envision you in the role, solving their problems. And for your closing statement, you don't just say thank you. You summarize your case. You look them in the eye and say, thank you for your time. Based on our conversation about your upcoming EHR upgrade and the need to improve clinical documentation integrity, this role seems like a perfect fit for my background in project management and physician education. I'm confident I have the skills to help you navigate that transition successfully, and I'm very excited about the opportunity. It's confident. It's specific. It's your closing argument. And then within 24 hours, you send a personalized thank you email. Not a generic template. You reference a specific, interesting point from your conversation with each person you met. This reinforces that you were engaged, you were listening, and you have impeccable follow-through. It is the final polished piece of evidence that you aren't just qualified for the job. You are the inevitable choice. And then the call comes. The email lands. The words you've been working towards finally materialize. We'd like to extend you an offer. In that moment, all the studying, the certification prep, the resume polishing, the interview rehearsals, it all culminates. But this isn't the finish line. It's the starting gate of your professional race. When you receive that offer, take a breath. Express your gratitude and enthusiasm, but always ask for the offer in writing and for a day or two to review it. This is standard professional practice. It shows you're deliberate, not desperate. Review every detail, the salary, the benefits, the paid time off, the reporting structure. Compare it to the market research you did weeks ago. Does it align with your value? If it's a strong offer, fantastic. If it's low, don't be afraid to negotiate. A respectful, data-backed counteroffer isn't greedy. It's a business conversation. You can state something like, thank you so much for the offer. I am incredibly excited about the opportunity to join the team. Based on my RHIA certification, my experience with the Epic system, and the market rate for this role in our region, I was anticipating a salary closer to X. Would you be able to match that figure? The worst they can say is no. But by not asking, you might be leaving thousands of dollars on the table over the course of your career. Once you've accepted, the real work begins. Your first 90 days will define your trajectory within that organization. This isn't just about learning the job. It's about proving their decision to hire you was the best one they could have possibly made. Think of it as a 3-act play. Act 1, the first 30 days. Your mission is to become a sponge. Your primary job is not to fix things, not to implement grand new ideas, but to listen, learn, and absorb. You need to understand the ecosystem you've just entered. Schedule one-on-one meetings with your direct reports, your peers in other departments, and your own manager. Your goal in these meetings is to ask questions. What's working well? What are the biggest challenges in your workflow? If you had a magic wand, what's the one thing you would change about the health information process here? Listen more than you speak. Take copious notes. Learn the names, learn the systems, and most importantly, learn the informal political structure. Who are the influencers? Who are the go-to problem solvers? Who holds the historical knowledge? You are mapping the human terrain of the organization. During this month, you focus on mastering the core functions of your role, but you resist the urge to critique or change anything. You are building trust by demonstrating humility and a genuine desire to understand before acting. Act 2 days 31 to 60. Now, you transition from sponge to contributor. Using the knowledge you gathered in your first month, you identify what's called low-hanging fruit. These are small, visible problems that you can solve quickly and effectively, creating an immediate positive impact without requiring a massive budget or cross-departmental approval. Maybe it's a clunky spreadsheet used for tracking physician query responses that you can streamline. Perhaps it's a communication breakdown between the coding team and the clinical documentation specialist that a simple weekly huddle could solve. You execute these small wins. This does 2 things. First, it demonstrates your competence and your value to the team. Second, it builds political capital. You're no longer just the new manager. You're the manager who fixed that annoying problem everyone complained about. You are earning the right to suggest bigger changes later on. You are proving your judgment. Act 3, days 61 to 90. This is where you become a strategist. You now have a solid understanding of the people, the processes, and the politics. You've built trust and have some small wins under your belt. Now, you can start to address one of the larger challenges you identified back in month 1. You consolidate your notes, your observations, and your data, and you formulate a plan. You don't just walk into your boss's office and say, "The system is broken." You say, "I've observed a recurring issue with our release of information workflow that is causing an average delay of 3 days, and has led to a 10% increase in patient complaints over the last 6 months. I have a 3-phase proposal to address this by implementing a new batch processing protocol and retraining the staff on updated privacy verification steps. I project this could reduce our turnaround time by 40% and significantly improve patient satisfaction. Here's the data." You present the problem, the evidence, the solution, and the expected outcome. You have now transitioned from a new hire to a leader. You've passed the test. This 90-day framework is your launchpad. But a health information manager's career isn't static. It's a dynamic, evolving journey. The manager you are on day 91 is not the leader you will be in 5 years. The next phase of your career is about strategic growth. This means looking beyond your daily tasks and seeing the bigger picture. You must become a lifelong learner. The healthcare landscape is in a constant state of flux. New regulations like the 21st Century Cures Act change how you handle data. New technologies like artificial intelligence are beginning to revolutionize medical coding and data analytics. You must stay ahead of these curves. Pursue advanced certifications. If you have your RHIT, map out a plan to get your bachelor's degree and sit for the RHIA exam. Look into specialty credentials from AHIMA, like the Certified Health Data Analyst or the Certified in Healthcare Privacy and Security. These aren't just letters after your name. They are signals to the industry that you are committed to mastery. As you grow, your path can branch in several directions. You might climb the traditional ladder, moving from manager to director of health information management for a single hospital, and then to a role overseeing him for an entire health system. In these roles, you're not just managing a department. You're setting policy, managing multi-million-dollar budgets, and shaping the data governance strategy for the entire organization. Or you might choose to specialize. You could pivot into a full-time compliance role, becoming a corporate compliance officer, ensuring the entire organization adheres to the labyrinth of federal and state regulations. You could dive deep into the world of data, becoming a director of clinical analytics, using the information you manage to identify trends, improve patient outcomes, and drive business strategy. You could move into the technology sector, working for an electronic health record vendor as a consultant, using your real-world experience to help hospitals all over the country implement and optimize their systems. The possibilities are vast, but they are only open to those who are proactive about their own development. But through all of this, the certifications, the job hunt, the first 90 days, the long-term career planning, it is critical to never lose sight of the fundamental why. Why does this job matter? Because behind every record, every code, every data point is a person, a human being. That medical record you are safeguarding is the story of someone's life at its most vulnerable moment. The data integrity you fight for is what allows a doctor to make a life or death decision with confidence. The privacy you protect is what allows a patient to seek care with dignity. The accuracy of your coding is what ensures a hospital can keep its doors open to serve the community. You are not a records keeper. You are a guardian of stories. You are not a data manager. You are a truth defender. In a world drowning in information, you provide clarity. In a system that can often feel impersonal, you are a steward of the individual's most personal information. This is the profound responsibility and the incredible privilege of being a health information manager. This entire journey, from the first spark of curiosity about the field to becoming a strategic leader, is a marathon. It requires diligence, intelligence, and a deep sense of purpose. But every step is achievable. Every challenge is surmountable. We've laid out the map. We've shown you the path, the tools, the mindset. The rest is up to you. The healthcare system doesn't just need people. It needs leaders. It needs guardians. It needs you. Your journey starts now. Go build it.